Hi, so it's Dr. Fox, licensed psychologist in the state of Texas, and an expert in the area of personality disorders. And this is one of those special videos that I like to create in this new series whenever a personality disorder is in the headlines or folks are reading a lot about it for one reason or another. And so in this video, we're going to focus on the Johnny Depp and Amber Heard trial. Now, first, I have to say that I don't know either individual, Johnny Depp or Amber Heard. Also, I don't know the forensic evaluator, Dr. Shannon Curry. And this is really important, as what I'm going to address is what's in the media. And the media is a massive telephone game, right? Remember when you were in like kindergarten and a telephone game and one person says one thing and then someone says something else and they pass it around. And as it gets passed around, it continues to get distorted. And that's what happens with information, particularly, I believe, as it relates to personality disorders, which are difficult for many folks to understand even outside of the media when it's really popular. So that's why I think this video is particularly relevant and salient, because you're going to hear more about BPD, HPD, which is histrionic personality disorder, and I wanted to add some reality to it, reality to the lens. So let's get to it, let's break it down, and here we go. Don't forget, like, share, and subscribe. Appreciate it. Here we go. Now, this trial reportedly focuses on defamation and domestic abuse that has brought histrionic and borderline personality disorder into the spotlight again. Now, this happens from time to time, as we know, we see it happen, and it brings it up, but it's never in a good way. So we're going to talk about it and what it means and what you can do to insulate yourself, because this can be particularly damaging for folks who are along that BPD spectrum, as well as those that are along the HPD, histrionic personality disorder spectrum as well. So we want to talk about that. We want to break it down. Then I'm going to give you some tips also how to insulate yourself and protect yourself. So now the trial is about Johnny suing Amber for defamation over a 2018 op-ed she wrote for the Washington Post about surviving domestic violence, though she never mentioned Johnny by name in the article. So he originally filed this $50 million lawsuit in March of 2019. Reportedly, Amber was evaluated by a forensic psychologist hired by Johnny's legal team, and they identified BPD, borderline personality disorder, and HPD, histrionic personality disorder traits, as well as PTSD. Now, this is one-sided, as reportedly, Amber was asked to do the evaluation, but Johnny was not. Now, remember, we have to be aware of the misunderstandings related to the diagnosis of BPD and HPD. And part of that misunderstanding is that there's a higher prevalence, a skew, that is more prevalent in females than males. However, the reality is that it's about equal, particularly for BPD, which is about 48% male, 52% female. So a lot of folks who aren't aware of the current prevalence have a tendency to skew BPD towards female. Okay, so there could be a bit of a skew there. Do I know? No. Have I seen the data? No. But remember, it's the telephone game. We want to bring some reality to it. We want to bring some rational lens to it so that we can understand it and pick it apart. Now, Dr. Curry reported supportive indicators for BPD and HPD, but did not find support for PTSD, but recognized that, and this is a quote, "Just because somebody doesn't have PTSD doesn't mean that they weren't harmed psychologically by whatever is being alleged in this case. Ms. Heard is alleging that she was psychologically harmed and that she suffered PTSD because of abuse that she alleges occurred by Mr. Depp." Now, that's a direct quote. And it's really relevant, I think, to see that. It sounds like, Dr. Curry is doing her best. She's putting that objective lens on, and I think that that's really important. Because I think as mental health providers, we have to be sure that we're providing objective information out there, not getting caught up in the availability heuristic, which we're going to talk about in a second. But before we do that, let's break down what these two disorders are. BPD is a constellation of traits and behaviors that includes unstable relationships, idealization and devaluation of others as well as the self, fear of abandonment and rejection, Feelings of emptiness, suicidal gestures, and threats are often present as well. There's inappropriate anger responses. There's uncertainty about who you are and what you want to achieve. There is also engagement in self-damaging behaviors. This could be drug abuse, spending, etc. And that's not particularly related to Amber or to Johnny in this case. We're just talking about aspects of BPD. There's a tendency for stress-related paranoia and or dissociative experiences. And all of these factors adversely impact your relationships and your work life. And that's really important. Just having these factors, remember, all disorders are on a spectrum. So it's important that we realize that. So when we talk about BPD and the full disorder, what we're talking about is that all of these traits, or 5 or more of these traits, that they adversely impact their relationships, your relationships, as well as your ability to go to work, maintain employment, take care of your daily living skills and responsibility. Now let's talk about HPD, Histrionic Personality Disorder. Now this is different from BPD, but also there's some similarities to it as well. Now, this collection of traits for histrionic personality disorder, this includes the need to be the center of attention. Interactions are often overly sexualized or provocative in order to gain attention. It's changing emotions and what are called shallow expressions of emotions. This is when these individuals show emotions or exhibit emotions. They seem very superficial and fake, though they may not be, because sometimes individuals with HPD, they struggle with understanding emotions, expressing emotions in an authentic way, because they tend to be overly fixated on getting attention and getting that external object or objects, whatever's outside of them, to get them approval in regards to getting attention, being understood, being seen and heard. Also for HPD, it's a physical presentation is often used to garner attention from others. The speech is often laced with attention-getting phrases or words. This can be curse words, sexual terms, or flirtatious speech. Also tends to be dramatic and overly expressive in presentation with the goal of getting attention. These folks are also easily influenced and suggestible, particularly by those the individual finds attractive or of high value. Relationships are often seen as more intimate and important than they actually are. Now, all of these traits add to the adverse impact of your relationship and work life, right? They have to cause that socioeconomic dysfunction. Just having these traits is not enough, just exhibiting them. Remember, we go back to that spectrum. They have to impair your ability, right, for your relationships. Also impact your ability to go to work, to fulfill your responsibilities. Now, according to Dr. Curry, there is evidence to support these 2 personality diagnoses, and she used testing and records review. Now, there are some issues that are important to consider, as reportedly, and this is a quote, Dr. Curry was also asked about having dinner and drinks at Depp's home before she was placed on retainer. Dr. Curry said the meeting was between herself and the actor's legal team, not Depp himself. She also said it wasn't her job to evaluate Depp in this case. Now, this can be a factor of objectivity, right? But again, we have to remember the telephone game. What's reported may not be the whole truth, and we have to bear that in mind. And I'm not on one side or the other. I don't know either one or anything like that. All I'm saying is that we always have to take information from the media. We always have to be really good consumers of information. And just because it's put out there, what's the source? Do we know them? Do we know what really happened? We don't, because it's from the media. So we have the telephone game. So we have to add that grain of salt because that's really important. But a lot of folks aren't going to do that. And that's why this video, I think, is so important, because we're talking about what BPD is, what HPD is, because typically the media is not very compassionate and understanding about folks who have these disorders. Now, this issue and trial brings BPD and HPD into the limelight, and I mentioned that before. But how does this impact you? And that's what's really important, how it impacts you. Well, you'll start to see an increase in BPD and HPD diagnoses. It's important to know that human beings are influenced by the availability heuristic. I talked about it earlier, and I have a video on it as well, which is a mental shortcut that is based on immediate examples, like this trial, that come to a person's mind when evaluating a specific topic, concept, method or decision, such as BPD or HPD. Okay? And the availability heuristic operates on the belief that if something can be recalled, it must be important and valid, or at least more important than other solutions which are not as readily recalled. So what this means is because you can pull it from memory, you have a higher probability of believing that it's true. You are more likely to grab onto this belief, but also because you'll see it more often in the news, probably for the next week, 2 weeks, whatever it may be, that you are at a higher likelihood to be diagnosed with these things. You're at a higher likelihood for people to use these terms even more than they were prior to this trial. And this is why data is so important and testing is so critical to know if you have HPD or BPD. Remember, not everyone with BPD and or HPD are in abusive relationships. That all disorders are on a continuum and spectrum. Remember that. And that treatment is possible with these two disorders, even if they're comorbid or if they occur separately. And the media and telephone game, they want you to believe the worst. And the reason why they want you to believe that is not that they want to hurt you, but they want you to tune in. They want you to read the articles. They want you to watch the videos. They want you to do all these things. And this can be really dangerous for folks that are along these two disorder spectrums. And this is why using good judgment and assess yourself outside of this attention headline-grabbing trial is important. Some of this may be triggering, but it's important to separate yourself from the issues. Separate yourself from Johnny and Amber, right? You don't want to get caught into that and say, oh my God, that's me, that's me. We want to look at the data. That's why I went over the criteria. That's why I'm trying to add some counterfactual thinking for you where you can reconsider what might be going on. Now, maybe this is an impetus for you to go and get help, and that's awesome. Or to learn more about yourself, what might be going on, or what is driving some of your fears and issues and problems in relationships or at work. That's really great, and that's really important. But also bear in mind that all this stuff, the availability heuristic and things in the news, that for those along the BPD spectrum that also have that unstable self-image, that may be causing you to be hyper-focused on this trial and Amber's experience or even Johnny's. So remember, you're a separate entity, that's important, and you choose your path. You can make good choices to go forward and help yourself, and that's what this channel is all about. And that's what I hope this video does for you. I hope it gives you some insight, encourages you to take that insight and develop adaptive strategies. I have all types of tips and strategies in all my other videos that I hope can help you. I hope you find this helpful. Please like, share, and subscribe, and please be well and stay strong. Thank you. Bye-bye.